Cardiovascular disease is the leading cause of death in the world, with ischemic heart disease and strokes resulting in over 15 million deaths annually. In the United States alone, there are nearly 800,000 heart attacks each year, and less than half of these patients are able to be saved by doctors. About 30 to 40% of heart attack survivors suffer from heart failure, resulting in significantly shortened lives. Now, there is a promising new drug for treating heart attacks. A team of scientists at the University of Illinois at Chicago, led by Professor Xiaoping Du, and in collaboration with scientists at DuPage Medical Technology Incorporated, have invented a new drug using an innovative, high-loading peptide nanoparticle technology to improve the chance of surviving a heart attack and reduce the likelihood of developing heart failure. This new drug has been successfully tested in mice, as reported in the upcoming issue of Science Translational Medicine. A heart attack can cause heart failure and death in two ways. The first is that clots in an artery block blood flow into the heart, resulting in a lack of oxygen in the heart that leads to ischemic injury. The second can arise due to complications in the treatment of the blocked artery. After the blocked artery is reopened, fresh blood flowing into the injured heart tissue causes inflammation, leaks, and clots in small blood vessels, resulting in reperfusion injury. Current anti-platelet drugs have been successfully used to prevent thrombosis, or clotting, but do not sufficiently reduce inflammation, and they cause blood vessels to leak and bleed, which can make reperfusion injury worse. This occurs because platelet adhesion to the blood vessel wall is normally needed to prevent leaks, but can cause vessel blockage when they form abnormally expanded clots. Current antiplatelet drugs, such as Plavix and aspirin, prevent clots that block the blood vessel, but also prevent platelet adhesion and aggregation on vessel walls that is essential to stop bleeding. To avoid this issue, a treatment was needed that would allow for the initial platelet adhesion to patch the leak in the blood vessel, but selectively prevent uncontrolled vessel-blocking clot expansion. This is exactly what Dr. Xiaoping Du and his team were able to achieve with their novel drug, providing potentially good news to patients needing surgery or patients who have bleeding tendencies. This new drug, currently termed M3-MP6 high-loading peptide nanoparticle, was tested for efficacy using a mouse heart attack model, and the results have been impressive. The M3-MP6 high-loading peptide nanoparticle reduced damage to heart tissue, inhibited clotting, reduced inflammation, improved function of the heart, and improved survival rates of the mice. While the currently available antiplatelet drugs are great at preventing thrombosis, their ability to prevent inflammation is minimal, and they have major side effects of causing vessel leaking and bleeding. Meanwhile, the novel M3-MP6 high-loading peptide nanoparticle excels in inhibiting thrombosis and inflammation all without causing bleeding, while simultaneously improving survival rates. The scientists at the University of Illinois at Chicago and DuPage Medical Technology are currently working to bring this drug to clinical trials and eventually to the public for the treatment of heart attacks.